Hello, my name is Dr. Dave Webster, and this is part of my ongoing video blog series about the travesty of lack of access to PET-CT in Ontario. This particular video will be about Dr. Reuben Devlin, who the PC government has appointed as an advisor on healthcare issues. I'm going to end with a question to Mr. Devlin, which is, how do you want history to record your contribution to what up till now has been the unprecedented, scientifically baseless, unethical, and immoral actions by Ontario governments, their physicians, and they are directed at some of our sickest and most distressed patients. Dr. Reuben Devlin is a physician who eventually became CEO of Humber River Hospital, as well as a former president of the Ontario PC Party. During the Ontario election campaign, he was Mr. Ford's advisor on health policy matters. Now, after almost 40 years of experience, both as a physician and more importantly dealing with politicians, I had very low expectations about the PCs, but in my glass half full manner, I felt I needed to give them the benefit of the doubt. So in my first video on the PCs of Mr. Ford, I pointed out that initially I was very hopeful that Mr. Ford, particularly with his brother dying of cancer, would be willing to consider meaningful changes for the benefit of Ontario's patients. Mr. Rob Ford was a patient at Humber River Hospital, where Dr. Devlin became personally involved with the Ford family during his illness. So when Dr. Devlin contacted me, you can imagine it seemed that my goals for Ontario patients had the first real chance for success in a very long time. So starting in April 2018, I had over 40 email exchanges and a long, frank telephone conversation with Dr. Devlin regarding my experience on PET, dealing with the Liberal government and their various medical experts over some 15 years. However, as the June election approached, it became clear that Dr. Devlin's real role was to string me along to ensure that I would not be critical of the PCs on my social media sites during the run-up to the election. So I would write one more letter on May 2018 before the actual elections regarding the Conservatives' position and how critical decisions are made for Ontario patients. And keep in mind, this is not just about PET. This is how critical healthcare decisions affecting you and your loved ones have been and will be continue to be made. In Ontario, it was directed, as you can see, to Mr. Doug Ford, Mr. Jeff Urick, who's the MPP for Elgin Middlesex, and of course Dr. Reuben Devlin. Now, but there were two key appointments after the Ford government came in power that made it absolutely clear to me what their agenda would be. And that was first and foremost the appointment of Dr. Reuben Devlin as the chair of the new council on, get this, improving healthcare in Ontario. But more disturbing and foreboding for Ontario's patients was the appointment of Ms. Christine Elliott as the Minister of Health. So on July 15th, I wrote an email to Dr. Devlin saying, "Dear Dr. Devlin, based on the lack of response to my emails during the latter part of the election, am I to assume that how Mr. Ford's government will deal with PET-CT will remain the status quo?" He responds tersely the same day, "Dr. Webster, you should not make any assumptions. You made your point and it was understood. Regards, Dr. Reuben Devlin." So I wrote back the same day and basically said that, based on my previous 15 years experience of dealing with Ontario politicians, senior government bureaucrats, and their medical experts, I was going to continue to work under the assumption that the Ford government will maintain the status quo on access to PET, at least until there was some tangible evidence to not hold that belief. Now, in my discussions with Dr. Devlin, I pointed out that the PCs could appropriately blame their Liberal predecessors for having proudly achieved the coveted official status of Ontario of, for one thing, having the least number of PET scans per thousand population amongst any medical jurisdiction in the world where PET technology is available. But I spoke more importantly about the tremendous and unique opportunity for the Ford government to bring about a real sea change in Ontario's healthcare system, a system that would be truly patient-focused, far more effective, and I assure you, less directly harmful to patients, and bonus, at less cost to the taxpayers. But after 8 months in power, it has become blatantly obvious that the PCs are quite pleased with the Liberals' accomplishments, which, by the way, when the PCs were in opposition, were fully aware of, but like the NDP, they deliberately chose not to oppose those things. So the PCs are about to unleash an omnibus bill restructuring healthcare bureaucracy in keeping with the conservative lines of thinking about big government, or at least big government that doesn't directly benefit those holding the majority of power and wealth. But most importantly, it will offer the PCs a chance to take misfortunes of Ontario's patients to a whole new era. The simple truth is that patients are one of the largest single sources of our massive public debt. But on the flip side, they are also a major source of income for a large number of very well-paid and politically powerful medical groups and private entrepreneurs. The analogy I would use is the relationship of government with the tobacco industry. The taxes government earned from tobacco addiction were enormous. The problem became, however, that with rising healthcare costs, it was becoming more expensive to treat smokers than they were earning by taxing them. What the PCs have figured out is that they can create a much leaner and truly meaner government bureaucracy, replete with a compliant team of medical experts, so that they can continue to ensure the income expectations of the politically powerful supporters will continue to be met, and at the same time keep the costs to the taxpayers as low as possible by ensuring that patients will be more likely to die prematurely at less cost by forcing Ontario doctors to practice medicine as if we were still living in the 1990s. So my question to Dr. Devlin again is this: how do you want history to record your contribution to what up till now has been the unprecedented, scientifically baseless, unethical, and immoral actions by Ontario governments and their medical experts directed at some of our sickest and most distressed patients? Now, in keeping with my efforts to help people make up their minds on critical healthcare issues and promote discussion by giving them the facts, I will continue to do what no self-respecting professional journalist would ever consider doing, and that is I'm going to give you the uneditorialized facts so that you can, again, have this discussion. So I'm going to publish online my initial letter to Mr. Ford during the 2018 election campaign, as well as that May 2018 letter I referred to above. Now, before I post a video explaining why, as one of the aging baby boomers, Ms. Christine Elliott scares me more than most politicians I've ever dealt with, I will present a case example that momentarily brought an entire OR team to a stunned silence. But what it'll make clear is this is a case which Dr. Devlin considers quality health care, and he is well aware that occurs on a daily basis in Ontario, or at least what the Ontario PC Party views as quality health care. So this is my social media sites and a website, and I need your help to force Dr. Devlin and the Ford government to make quality of health issues actually about Ontario's patients. So thanks for listening.